Hello, I am Diana, a radiography master's degree student. Today, I will talk about the importance of accuracy in radiotherapy. We will explore how precise treatment delivery affects clinical outcomes and why even small deviations can have significant consequences. Radiotherapy uses high-energy radiation to destroy or control growth of tumor cells. Since ionizing radiation can cause damage to normal tissues, radiotherapy must be delivered with high precision to ensure adequate dose coverage of the tumor while minimizing exposure to surrounding healthy structures. Radiotherapy must achieve a high level of geometric and dosimetric accuracy to ensure effective tumor control while minimizing normal tissue complications. A typical requirement in radiotherapy is to deliver dose within plus or minus 5% accuracy. The treatment target is defined using multiple imaging modalities such as CT, MRI, and PET to accurately localize the tumor. The GTV represents the visible tumor, while the CTV includes areas of potential microscopic disease. To account for uncertainties such as patient positioning and organ motion, a margin is added to form the planning target volume, or PTV. These definitions are standardized according to ICRU recommendations. Target delineation is not arbitrary. It is guided by established clinical guidelines and expert consensus, developed through research studies, clinical trials, and international collaboration. Organizations such as ESTRO and RTOG provide recommendations to standardize this process. This helps ensure consistency and accuracy across different clinicians and institutions. This schematic illustrates the stepwise definition of target volumes, from GTV to PTV, incorporating microscopic spread, internal motion, and setup uncertainties. Radiation beams are shaped using multi-leaf collimators, or MLCs, which allow the beam to conform closely to the tumor geometry. Each beam is individually shaped by the MLC, and when combined from different angles, they create a high-dose region that closely matches the tumor. By delivering radiation from multiple angles, we can concentrate the dose within the target while reducing exposure to surrounding healthy tissues. Accurate patient positioning is essential to ensure that the planned dose is delivered correctly at every treatment session. Because radiotherapy is delivered over multiple fractions, the patient's position must be reproducible each time. Immobilization devices are used to minimize movement and improve consistency. Patient positioning is verified using image-guided radiotherapy, or IGRT, which uses imaging such as CBCT to confirm internal anatomy. Surface-guided radiotherapy, or SGRT, uses external surface tracking to monitor patient position in real time. Together, these techniques help ensure accurate and reproducible setup before and during treatment. Even small misalignments can result in deviations between the planned and delivered dose. In radiotherapy, even very small positional errors can have significant consequences. A shift of just a few millimeters can result in part of the tumor receiving less dose than planned, while nearby healthy tissues receive more. In addition to setup errors, internal anatomical changes can also significantly affect dose distribution. For example, variations in rectal filling can change its position and volume, leading to differences in the dose received. This highlights that accuracy in radiotherapy is not only about positioning, but also about managing internal variability. Both factors must be considered to ensure safe and effective treatment. Organs at risk, or ORs, are normal tissues that are sensitive to radiation and are located close to the treatment area. Because of their sensitivity, exposure to radiation can lead to side effects or complications. Therefore, protecting these structures is a key objective in radiotherapy, alongside effective tumor treatment. Inaccurate dose delivery can have significant clinical consequences. If the tumor receives less dose than planned, treatment effectiveness may be reduced. At the same time, excessive dose to organs at risk can lead to toxicity and side effects, which may be acute or long-term. This highlights that accuracy in radiotherapy is directly linked to patient outcomes. In addition to patient-related factors, the accuracy of radiotherapy also depends on the performance of the equipment. Quality assurance procedures are carried out regularly to ensure that the machine delivers the correct dose and that beam geometry is accurate. These checks include dose calibration, mechanical accuracy, and imaging system performance. Without proper quality assurance, even a well-planned treatment may not be delivered correctly. Modern radiotherapy techniques play a key role in achieving high accuracy. Intensity-modulated radiotherapy, or IMRT, allows modulation of beam intensity to better conform the dose to the tumor shape. Volumetric modulated arc therapy, or VMAT, delivers radiation continuously as the machine rotates around the patient, improving efficiency and precision. These technologies enable improved tumor targeting while reducing dose to surrounding organs at risk. In conclusion, accuracy in radiotherapy is achieved through a combination of multiple factors. It begins with precise target delineation using imaging, followed by accurate treatment planning and beam delivery. Patient positioning must be reproducible and verified using IGRT or SGRT. In addition, regular quality assurance ensures that the equipment performs as expected. Together, these elements ensure that the planned treatment is delivered safely and effectively. Here are the references. Thank you.